Good day, ladies and gentlemen. This is Watson Michael from Ceylon Institute of English and Leadership. And we're glad to have Dr. Gary DePaul back with us. So Dr. Gary DePaul, he is the Executive Leadership Development Consultant at Gary DePaul Leadership, the Distinguished Research Principal Fellow at the Conference Board. Also, he is an adjunct professor for Department of Educational Leadership at the University of North Carolina at Charlotte. So also a very interesting part is that he has authored 4 books. So today we're going to talk about one of his books, a very interesting books, which we have never spoken about before. So Gary, why did you give it such a unique and long name?
Yeah, this is good. So here's the book,
Okay.
and there's the name, The Most Effective and Responsible Clinical Training Techniques in Medicine, which I can barely say in one breath.
Yeah.
This is why I would call a novice mistake in writing a book. If you have a title this long, no one's going to remember it. And I even forget what the title is. I have to think about it for a while. It's better to have 2 words, 3 words, 1 word that you could remember, and then maybe have something like this at the bottom of the page. But it's it's if anyone writes a book or an article, don't write anything that long. People won't remember it. Books like Triggers. I remember that title. It's Triggers. It's by Marshall Goldsmith. It's 1 word,
Yeah.
This, don't do this. Don't do this at home. It's not a good idea. So it was a mistake. And a learner's mistake, I guess, in writing my first book. So since then I have learned.
Wow. Okay. So Gary, wait. So this is your first book?
Yes.
Wow. Okay. All right. So, what do you think is the biggest challenge the medical industry has these days with regards to trainings?
Yeah, that's a serious question that I think a lot of institutions do not necessarily get right. The thing about training in as the medical profession, especially on the clinical side, and it doesn't necessarily have to be in medicine, any clinical side. When you're training someone, it's not like training a bunch of techniques or a bunch of procedures.
Yeah.
How to remove a bladder stone or how to remove an appendix. That's the specific steps you do on that. But that's not what you're learning resident at a hospital, in a teaching hospital. What you're really learning is how to be to that profession. So it's how to think. Well, if you're an orthopedic surgeon, how to think like a surgeon, how you relate and talk with your team, how you talk with your patients, all this stuff, the whole mindset has to be learned. And that's partly why it takes so long to learn a specialty or subspecialty. In the United States, you go through 4 years of medical school and you become a doctor.
Okay.
But if you want to be a family practice doctor or an orthopedic surgeon or a surgeon or a gynecologist, you have to go through 4, 7, 8, 10, 12 years of additional training. And what they should be doing is having if you're an instructor, which at hospitals they call them attendings. If you're an attending, you really need an instructor's mindset, and you need to consciously, as goals, ensure that the people that you're training, that they're learning the social cognitive aspects of your field. And if you don't get that, if you just learn procedures and you behave how you want with the people you work with, your chances are you're gonna be cut if you can't learn it. And that is probably the most important part. But some teaching hospitals, they may not consciously think with that mindset that that's what they're trying to do as an instructional goal. It's, I could teach you how to do a specific procedure step by step by step, how to handle problems that may come up, but you, to really learn it, you need to learn the whole mindset, the cognitive part as well. And unfortunately, the techniques that some attendings employ or use, the most direct and most effective. That's why I wrote this book, is to teach people about, if you're an instructor, if you're in the medical profession, that you need to think more deliberately and consciously of what you're trying to do and accomplish, and really think through your goals, that it's not just teaching a procedure, it's also teaching the mindset and the social behaviors that go in that specific environment. The other problem with in the medical field is you're a resident, you're being paid. That, I mean, that's not a bad thing, but there's a role conflict. You're either a learner or you're an employee. You're kind of both. And your instructor, the attending, is your boss as well. So there's some role conflict that could happen. And sometimes if you're an attending, you may put the instruction part of it. You may not be thinking about it. You may be focusing with the resident as an employee and not thinking about what should this student, this resident needs to learn right now. So that's it's a difficult, it's very, let me put it this way, it's easy to get caught up in the employee-employer relationship and not thinking about being the instructor and having a student.
Wow, it's pretty interesting, and it's complicated too, right? Okay.
Very, very complicated. And unfortunately, there's not enough, I don't think there's enough preparation and training for people that are becoming attendees to work with students. And the tendency is, if you become a new attending, the way you teach is how you were taught.
Correct.
And you just kind of learn it trial and error, versus deliberately learning techniques and better ways of instructing students that you work with.
Wow, pretty interesting. So, can you let us know of a interesting chapter in this book?
Yeah, in chapter 3, I talk about the different techniques that you can use. Okay. And one of the techniques that I talk about is probably the most powerful teaching technique that anyone could use, and it's called cognitive apprenticeship.
Right. Okay.
And if you think about the name cognitive and apprenticeship, and you put those two together, the apprenticeship is if you think in the industrial age, you're an apprentice. You're learning from someone who's mastered the skill.
Yeah.
And usually that's how you start. So if you think about the publishing industry in the 18th century, you would start out as an apprentice. Yes. And you would be doing just easy stuff, so to speak, but also the mundane stuff.
Yeah.
When you become more skilled at that, you would become a journeyman,
I see.
and then you would become a master at your craft.
Yeah.
There's certain steps that you go through.
Hmm.
But with cognitive apprenticeship, it's not just doing certain things, but it's learning what's going on up here. So I could teach you, Watson, on
Yeah.
how to make changes on a computer program,
Yeah.
and I could show you the steps. And I've actually had this done with a student where I just explain what you need to do and show
Yeah.
how to do it.
Yeah.
And then I asked the student to do it, and the student could not do it. Even
Oh,
with notes, was making mistakes.
okay.
And it's because I didn't explain the thinking that went inside my head as I was doing it.
Yeah.
So cognitive apprenticeship is teaching you the mindset and what you're thinking about while you're doing the procedure. Or sometimes it's not, if you're doing sales, for example, you may not be able to explain it until after you meet with a client.
Yes.
So that's kind of the idea. But to do it, there's 5 steps, and the steps are pretty simple.
Okay.
The first step is, if I was the attending, I would show how to do the procedure. But as I do the procedure, I would talk aloud what I'm thinking in my head.
Yeah.
And I would want to articulate it. So if I was doing surgery in the chest, I would say, I'm noticing this happening over. I'm not a medical doctor, but this happening over here. I noticed that this area looks normal. There's something going on here, but I'm not too concerned about it right now. But I got to keep that. You're thinking as you're speaking aloud what you're thinking.
Yeah.
And it's kind of a challenge to do when you first do it, but it's really important. And this step is called modeling.
Yeah.
So I'm as the attending, I'm modeling the behavior and how to do it, and I'm sharing the thinking that's going on in my head. Then the next step 2, is giving the student an opportunity to practice, but it has to be in a controlled environment. So if in the medical field, you might be working on a cadaver, or something in some type of a controlled environment where you cannot make mistakes.
Yeah.
And you would actually show me, if I was the attending, how to do the procedure step by step.
Yes.
And you have to say aloud what you're doing. And then as you're explaining what you're thinking as you're doing it, I'm going to be there, and I'll do corrections, or I'll affirm that you're doing the right thing.
Yes.
And so you can get practice and be able to do the procedure.
Correct.
Then the next phase is where you actually try the procedure. But again, you would as the student, you would be articulating aloud while the attending is watching. And the next phase is called fading, where you're actually pulling back as the attending and saying less, and letting the student do the procedure without interrupting or interference.
Yeah.
They may ask you questions. So your role is, and for this phase, you're consulting, and you're just there to provide some support. And then the last phase is called generalization, where at this point, I would be talking with you about the procedure you learned, and then talking about other procedures where you might use some of the techniques that you learned from doing this one. And it's just generalizing to give you a bigger picture of how this fits in with all the different other procedures. So you're developing a mental map and connecting different things together during that. And the 5 phases I just described may not happen all at once. And one day it may take a while to do all that. But you do it over time, and those are the phases that you think of, and they're the most powerful. It's the most powerful way of avoiding mistakes in a high risk profession where you could have loss of limb, loss of where the patient could die. This is an important technique if you're in the nuclear engineering field. And you're working with a nuclear reactor. You just don't want students to go in and start learning how to do operate on a real nuclear reactor. You would actually have it in a controlled environment at first. But the trick is articulating aloud what you're thinking, because if I just watched you do the procedure, I don't know what's going inside your head. And if you didn't tell me, I would have to infer what's going on, and I may make a wrong inference. I may make a mistake, and that could actually cause problems down the road. And that's where people get into trouble, because they just watch it. The guy, what he's doing, but doesn't really explain. And then it's up to you to figure out the lesson. That's not a good way of learning. So that's one of the most powerful techniques. And I use variations of cognitive apprenticeship in instruction that I do. But the big thing is you don't set people up for failure. There's something called guided shaming. Is when you do that. And yes, some attendings deliberately set someone up to where they fail. I've seen a leadership program where the instructor would ask people to demonstrate coaching without teaching anything. And when they make a mistake, they say, well, here's what you did wrong. You did this wrong, this wrong, this wrong. Now let me show you how to do it right. You start off and say, I'm going to show you how to do it right. And I want to explain it to you. I want you to know what I'm thinking when I ask these particular questions. That's completely different, a different way of doing it. But the guided shaming, the just figure it out on your own, infer what I'm thinking, that's where problems occur.
So I think you and me have been shamed in our corporate careers, right?
Yeah, it happens.
So, Gary, how will this book help those who are employed in the medical industry?
Yeah, it's a good way of resetting how you teach. A lot of people go in, like I said, they learn by trial and error. They just kind of do teach the way they were taught. But what this book does is says, look, you gotta think bigger than just a bunch of procedures that you're teaching someone. You have to think about the social environment. You have to, you're not just communicating how to do these particular steps in a procedure. You're teaching, how do you work with nurses? How do you work with administrators? How do you talk to patients? There's something called bedside manner. And if someone doesn't have it, they would say, oh, that doctor's terrible, had the worst bedside manner. I'll never go back to that doctor. And that happens too. But if you have good ways, if you learn good ways of interacting and communicating with patients, that's part of the social cognitive learning that you go through. So what this book does is it helps you reset yourself and how you think about yourself as an instructor.
Absolutely. So it's spot on. right? I think many of us have been to a particular doctor and where we didn't like that doctor afterwards for certain reasons. Yeah. So how will you summarize this book in one sentence?
If I had to do it, thinking about that, it's almost like the title.
Okay.
The most effective and responsible clinical training techniques in medicine that you can use. I mean, that would be it in a sentence, but it really is about being very deliberate. This book helps you be very deliberate with how you instruct in high risk environments where there could be loss of life, loss of limb, permanent damage if you do not effectively instruct your apprentices or residents or students, if you want to call them that. And that's how this book would help.
Absolutely. So spot on. So one of the most important word which Gary said was, or words rather, Gary said was high risk environments. So for those who are employed in the high risk environments and as well as the medical industry, and if you want to find an interesting book where you can get some insights, well, you know what to do, right? So you can go ahead and purchase Gary's book and read it. So Gary, once again, would you mind showing the book to us?
Oh,
Yeah, so the
sure.
name, right. So it's called The Most Effective and Responsible Clinical Training Techniques in Medicine, right? So you can gain valuable information by reading that book, especially how to work in a high risk environment. So Gary, thank you once again for taking time and doing this podcast with us.
You're welcome. And I greatly appreciate your camaraderie and friendship, Watson.
Cheers, Gary.
Cheers.